All right, guys, next up, we have Biotricity. We have Waqas Al-Siddiq, the CEO, chairman, and founder of Biotricity. How's it going?
Not too bad. How are you doing?
I'm doing wonderfully. Thank you for being with us today, man. For the folks that are not familiar with Biotricity, could you please give us an introduction?
Absolutely. So, Biotricity, we're a remote patient monitoring company. We're focused on real-time cardiac diagnostics. We really saw a gap in the marketplace where, connected devices and the idea of monitoring is actually passive recording in healthcare, where you take devices, you put them on patients, you record data, and then 2 weeks later you get a report. And we felt the future was real-time monitoring. And so we built a real-time monitoring platform, applied it in cardiac because it's the #1 problem in the world. And we have a pipeline of products to basically go deeper into the space and have an award-winning product that is growing quite rapidly in the marketplace today.
Great introduction. Do you have a presentation for us today?
Absolutely.
All right, fantastic. I'll get out of your way, sir.
No problem. And just to kick things off, I just want to thank everybody for being here and attending. As customary, a quick forward-looking statement to just talk about, the conversation that's going to be taking place, and some of the things that I'm talking about are future-oriented statements, and there are elements of subjective judgment and analysis that may or may not prove to be correct. And with that said, we're very excited right now at Biotricity. We think it's an exciting time to be looking at the company. We're certainly very excited about 2021 and 2022. And as I kind of alluded to is in the premise of the company and how Biotricity got started, because I think that's an important element to really understand the fabric of a company and where it came from. And we saw this gap in the marketplace where passive monitoring is what's the standard. And we talk about monitoring, but really it's passive recording. And what that means is data is put on a patient, but it's downloaded and reported on after a couple of weeks. And so that's great, but for high-risk patients, it doesn't work, right? Because high-risk patients, you really need to respond immediately. And COVID certainly amplified this issue and showed us that when we're going to self-isolation, when we're getting patients out, we really need to focus on providing data in a quick and in a fast fashion. And so our device has built-in cellular technology. It's a one-piece solution. It's worn around your neck, underneath your shirt, and it's used for arrhythmia monitoring. And when it detects an emergency, because it's a smart device, it transmits it to a call center. The call center reviews the data and deals with emergency response. Now, that product is being used by 1,100 cardiologists across 23 states. I know it says 700 cardiologists, but we've grown since then. We did $1 million in our last quarter, but we're already, which was a run rate of 4 million. And now at the end of last quarter, we were already at a run rate of 7 million. We have close to 100% retention rate and 100% reorder rate, which means we have very, very big stickiness with our customers. And they're staying with us over a period of time. We started the product in April of 2019. We got clearance earlier, but 2018 was spent figuring out insurance, launched the product in 2019. And since then, we have been growing month over month and have had 23 months of consecutive growth, except for 1 month related to COVID. And we've got multiple FDA submissions in the pipeline, and we are very excited about the future. And to kind of talk about the future and talk about why we are looking at the cardiac market. So cardiac market is the #1 killer. 30 million people at risk in the United States, 17 million people have diagnosis. And the issue is, and again, accelerated by COVID, is that physicians need an integrated approach within their practice. They need to be able to diagnose and prescribe monitoring equipment to patients that have multiple diseases, and they need to be able to do it from their office, as opposed to sending the patient across the street or to some third party to do the lab or to do the diagnosis. And the reason for that is because you lose track of the patient, right? And you have to do the follow-up. And so if you can hook up the patient, if you can send them on the way and then bring them back, it improves physician liability, reduces patient risk, and improves the speed to diagnosis. And so our future and our roadmap and what we're doing at Biotricity is really about understanding the patient life cycle And so today we are in the world of diagnosis, right? We're helping diagnose. But after a patient gets diagnosed, they get a prescription or they get an interventional procedure, and then they go into management and continuous follow-up and coaching. And so our product roadmap and what we want to do at Biotricity is really to touch more and more of these circles as we go on. And the advantage of that is, we already have an ecosystem platform, as I mentioned, 1,100 cardiologists across 23 states, but we're only touching a fraction of that population because not everybody needs diagnostics on a monthly basis. So how do you touch those patients more often? Well, you have to provide solutions that address other needs that those patients are having. And that does two things. It helps you go deeper within your network, but also increases your total addressable market. And so, what does that do from our perspective in our product roadmap, which I will talk to shortly. The Bioflux is $1 billion market. That's our product right now. When we bring in our next product, which is the Biotray, hopefully later this year, that's a $3 billion market. Our TAM increases by $2 billion. Then we go into disease management. That increases our total addressable market to $30 billion. And then you keep on increasing this TAM with another product solution, and we end up with a $50 billion market. And so, whereas we had one product addressing, one market, we then have 5 products that are, exponentially growing our total addressable market. And so that's what we are super excited about at Biotricity. And we think that, 2021 for us, this year is an exciting year because we are executing on this product roadmap, and we are focused on bringing some of these products to market. And so if you talk about today, right? So today, 100% of our revenue is the Bioflux, which is about 5%, right, of the patient population. So, what does that mean? Let me kind of quantify that. We have 1,100 cardiologists, each approximately see 2,000 patients. So you got 2.2 million patients. But we're seeing a small, tiny fraction of them because not all of them need diagnosis every month. It's diagnostics is once a year kind of thing, right? You diagnose the patient, and then you check their diagnosis the following year or 6 months later to see if something has changed for the baseline. So what we will see is that Biotricity is going to really move into more of more touch points, right? So the next product, Biotray, which is going to hopefully come out later this year, it's going to have a 10% usage. This is for low-risk patients. Then we've got chronic cardiac, which is around the whole disease management program with remote medicine, remote delivery, collection of data from the patient, additional touch points. That is a much higher volume product, lower revenue for sure. But what will end up happening is that since there's a lot more touch points there and there's a lot more addressable population because you're touching more patients in between diagnostics, you'll see this shift in revenue. And that is what is exciting for us, this transformation that we're on the cusp of by executing on our product roadmap. And so the question is, why remote monitoring? Why are you guys doing this? Why is this important? Well, in one aspect, COVID has certainly shown, the importance of real-time monitoring and non-passive solutions. And this is why global remote patient monitoring is exponentially growing. CMS has already come out and said, hey, real-time monitoring is the future. And one of the biggest problems is this lack of cross-compatibility. And this is why when we originally launched the Bioflux, this idea of compatibility, right? Where, cardiac devices don't communicate with diabetic devices. There's no integration. There's no sharing of data. Sleep apnea is siloed out. And so we really focused on creating interoperability because we know that a cardiac patient does develop other diseases. And so eventually they may need or have a requirement for access to other data. And so we can bring that into our ecosystem. And so today, what is our product? What are we doing with the Bioflux? We talked a little bit about it. So we have a real-time monitor, as I mentioned. It's hung around your neck. It's got 3 little points. It collects your data. But what it's really doing is it's actively monitoring the patient. It's an intelligent device. So you put the device on. If it detects an anomaly, it alerts the call center. So for high-risk patients, you're talking about patients that if they were on a Holter product, they would not survive. And so this is a solution that is helping them and getting them into the hospital and speeding up diagnosis. And our business model is a technology as a service model, which is a very critical component of Biotricity because we focus on this SaaS model. We don't want to do the procedural work. We want to let the physician do it because that's their expertise. And so whereas the traditional approach in the space is send the patient across the street, get the test, and then come back to me, where the doctor makes $25. Here, the doctor hooks up the patient, diagnoses the patient, bills insurance directly, and instead of making $25, they make $500, and we make between $250 to $300 on per use. And so the patient comes in, gets a device, goes home, comes back, gives the device back, doctor cleans it up, puts it on to the next patient, and every time it's used, we generate a revenue, as does the doctor from their diagnostics and their clinical work. And so that model not only is economical and valuable to the physician, it also creates a technology as a service model for us, which is very unique in the healthcare space. And why is MCT important? Why is it critical? As I talk about, high risk patients, you got patients that have large pauses or emergency situations. Passive devices just don't work, and that's why you can't have long-term monitoring. And most of these issues are intermittent, so long-term monitoring is important. But then again, it creates higher risk, because if you don't have a connected device and you send a patient out for a week, they can potentially have a heart attack and not make it, and that becomes a big problem. And that's why real-time monitoring is the future. So kind of simplifying and kind of distilling down, what is the Bioflux today? It's a device, it's a third-party monitoring center, and it's all the data available to you, on your tablet, phone, laptop, wherever you need it. And all insurance reimbursable under existing CPT codes. And so if you take the competitive market in the landscape, there's really 5 players in the space. And I would say even less if you talk about it, because the reality is that Preventive Solutions, which just got acquired, don't actually have their own device. They're using a TZ Medical Scott Care device. So there are 5 brands, meaning Preventis, InfoBionics, Biotel, us, and TZ Medical Scott Care. But there's only 4 people who actually own technology in this space, which is real-time monitoring, not to be confused with Holter monitoring or passive recording. And I'm going to oversimplify this slide, but it's basically, we are cheaper, better, faster. We're the smallest, most accurate device in the market. We have the most channels, and we've consolidated the device into one piece instead of giving the patient a device plus a cell phone, so they have multiple things to keep track of. And most importantly, outside of a disruptive business model, the cheaper, better, the disruptive technology model, cheaper, better, faster, we have a disruptive business model, which is an in-sourced business model, which allows the physician to bill directly with insurance. It gives a recurring recurring revenue for the physician, and it allows us to have a technology as a service model with high margin for Biotricity. And again, the model is the reusable device. Doctor puts it on patient A, brings it back, cleans it up, puts it on patient B, and he or she does this once a month for 2 years, because the lifetime is 2 years. So the device generates us, $7,000 in revenue on a cost of goods of $383. And so our footprint today, 1,100 cardiologists across 23 states, over 300 different sites. We are super excited about this. This is growing. And because we have 100% reorder rate and nearly 100% retention rate, we're not losing customers. So every month we grow. So, the largest month in company history was December of 2020 until January of this year, until February, until March, until April. And now May will be bigger because we sold in April and we opened up many new centers in April and hospitals. And May will be, so May will automatically be bigger because those sites will start turning on. And so talk a little bit about our future products. We talked a lot about Bioflux, what we're excited about. We have this product, Biotrade, which is really a Holter product. So the idea of going deeper into the accounts for lower risk monitoring. This is a simpler device. We're waiting for our 510K clearance on it. We are super confident with our process with the FDA. We've cleared multiple devices, and this device is a much simpler device than the Bioflux. It's essentially a simplified version of the Bioflux for a market that is low risk and doesn't require real-time capabilities. So this will be upcoming this year, and this will increase our total addressable market from 1 billion to 3 billion. Then we've got this telemedicine that we've integrated with our system. And the idea here is, again, to be able to enable direct shipping of the Bioflux into the homes of individuals. This we accelerated because of the pandemic to make that available to patients so that they did not have to go in. And this, again, creates an interconnectivity between the patient so that there can be engagement remotely. And again, allows another touch point into our ecosystem. And then we've got the application, the Bioflux app, which is coming out, which is really around disease management. And everything that we do at Biotricity is aligned to CPT codes, right? We provide technology as a service to the physician where they have a business model and a revenue because it aligns with the existing CPT code. So a doctor can adopt a technology that we provide, as a company, and they immediately have a path to bill for it and collect revenue for it. So that's a very important thing because one of the biggest issues and hurdles in healthcare is how do you commercialize? And to kind of talk about a little bit about, the market competition, what's going on, because I think a lot of people ask us about, where we are, right? We're small, we're growing. We've done triple-digit growth since last year to this year. We'll do triple-digit growth this year. We'll do triple-digit growth next year, right? But we are also very beginning. So people talk about a company like Biotelemetry, which was acquired for $2.8 billion recently. But Biotelemetry started in 1994. They launched their first real-time product for 2002. So they've been around for 2 decades. They spent hundreds of millions of dollars, right? We've spent, a fraction of that cost. So we're very early in our life cycle. It's kind of like a toddler compared to a university graduate. Yet we are growing way faster, and we can accelerate that growth compared to some of these bigger guys. So I think investors have a real opportunity where they're like, okay, Biotricity, today is going to have triple-digit growth in 2021, triple-digit growth in 2022, but we can also grow even faster than that. And so it won't take us as much time to achieve those big values. And I think that is a very exciting aspect of what we are doing today. Another company we talked about, Preventive Solutions. It got acquired for $1.2 billion and did $158 million in revenue. And again, they launched their product in 2012. So again, been around for a decade. We've launched our product in 2019. We've been around for 2 years, and yet again, the same thing. We're growing faster than Preventis is. So it will take us a lot less time to get to evaluation, to comparative valuation. So I think that's a fantastic opportunity for investors and a fantastic opportunity for the company to shine and show its effectiveness. And then I think a good comparison to who we are is really the Livongo, right? Livongo got acquired for $18 billion. And Livongo was very interesting because Livongo started as a diabetes glucometer company. And then they went into diabetes management and really about focusing on more touch points with the patients. And then they ended up getting, this approach of in-between visits. And that's really what Biotricity is doing. If you look at our product roadmap, what are we doing? We're doing diagnostics. Then we're doing lower end diagnostics. So we started at the most complex space, right? High risk patients, and then going into disease management, just like Livongo went into disease management. And I think that is the exciting thing where if someone is trying to compare or look at us, they really should be looking at the Livongos of the world or the Teladocs of the world as opposed to a traditional cardiac diagnostic company. And so I think that aspect of our company is missed by the markets, obviously, from my perspective, because, we're all, it's just the nature of being a smaller growing organization. But I think that's also is the big opportunity. And so, the last other product that we have, which is really going into prevention and is a consumer-oriented product, which is the Biohard. Again, very simplified version of the Bioflux, but for personal engagement and personal usage, for lifestyle management, for people who don't need a diagnosis, but are concerned with their cardiac issues, so they can, purchase this. And this is something that we're going to launch this year. Pre-orders already available, and we're super excited about this product because this, again, another touch point. And to kind of summarize about the team and what's, I always talk about the team and we talk about team, and I'm going to talk about this at a high level because really Biotricity's team is really broken up into 3 kind of groups, right? We have sales. Everybody comes from the startup experience. Everybody has experience in launching multiple products. And so that really lends itself well for our space. Operations, people who have gone through scale, driven companies from 5 million in revenue to 250 million in revenue. And management, again, around engineering and products and being able to launch products, multiple products over 30 countries. And the takeaway here is we have brought on people that have not only done something recently and done it before, but they've done it multiple times before. And they have specifically gone through the process of scaling companies. And that's, very exciting and a testament to the team and the growth that we've been able to do, which is, triple digit growth through a pandemic is a testament to that. And our board, similar kind of thing. We've attracted people from different walks of life with different experience, as well as our advisory board, from people who have operated, from people who have come from the financial industry, all to kind of coalesce and create this, this group mind think that brings in a variety of expertise, all designed to accelerate and scale an organization. And with that, I will turn it over for questions.
Well, I think we're actually just about at time. We actually don't have time for questions today, Waqas. Thank you so much for that presentation. The company is Biotricity. You've been fantastic, man. Thanks for being with us.
Thank you. Thank you for taking the time. And next time for questions.
Yeah, well, next time we'll have time for questions. Have a great weekend, man. All right, guys, that's Biotricity. Let's get that ticker back up on the screen, please. BTCY. BTCY.